Hello, friends. Welcome to episode 1228 of the Juicebox Podcast. Today, we're going to be adding to the Grand Round series with Dr. Hutchins. She's a pediatric endocrinologist and a member of the private Facebook group for the Juicebox Podcast. Nothing you hear on the Juicebox Podcast should be considered advice, medical or otherwise. Always consult a physician before making any changes to your healthcare plan. If you or a loved one has type 1 diabetes and you and that loved one are a U.S. resident, go to t1dexchange.org/juicebox and complete the survey. This quick survey is going to help type 1 diabetes research move forward. It's going to help you. It's going to help me. It's going to help other people. t1dexchange.org/juicebox. Complete the survey. When you place your first order for AG1 with my link, you'll get 5 free travel packs and a free year's supply of vitamin D. Drink ag1.com/juicebox. I know that Facebook has a bad reputation, but please give the private Facebook group for the Juicebox Podcast a healthy once-over. Juicebox Podcast, Type 1 Diabetes. Today's episode of the Juicebox Podcast is sponsored by Dexcom, makers of the Dexcom G7 and G6 continuous glucose monitoring systems. Dexcom.com/juicebox. Today's episode is sponsored by Medtronic Diabetes, a company that's bringing people together to redefine what it means to live with diabetes. Later in this episode, I'll be speaking with Jalen. He was diagnosed with type 1 diabetes at 14. He's 29 now. He's going to tell you a little bit about his story. To hear more stories with Medtronic Champions, go to medtronicdiabetes.com/juicebox or search the hashtag Medtronic Champion on your favorite social media platform. The Touch by Type 1 event live in Orlando is coming up fast, September 14th. Tickets are available. They're free. I'm going to be there. Today I found out Jenny Smith is going to be there. Head now to touchedbytype1.org, go to the programs tab, and get yourself some absolutely free ticks. Ticks, that's short for tickets. It's free. Go register now.
Hello, I'm Dr. Jessica Hutchins. I am a pediatric endocrinologist in Georgia.
Do I call you Jessica or Dr. Hutchins?
You can call me Jessica.
Thank you, Jessica. I feel like I know you, even though I probably couldn't pick you out of a lineup if I had to.
It's been like over 2 years, I think, at least 2. Yeah, definitely well over 2 years that I've been on the Facebook group and sending patients to the podcast and the Facebook group. So yeah.
Can I start there? How do you make your way to it?
I actually found out from a patient. One of my patient's moms asked me one day, "Had you heard of the Juicebox Podcast?" I was like, "No." And honestly, I think when she asked me, I wasn't really I had just kind of started getting into podcasts in general. Mm-hmm. And so I just had not been a podcast person before, and then kind of started listening, dabbling in podcast listening. And then she mentioned it. So then I was like, "Ooh, I got to check that out." And then since then was just kind of hooked to it. And I really like a lot of the episodes. I enjoy the episodes of people telling their story, but I actually enjoy the education ones that you and Jenny do and the series, because it helps me have little fun ways to explain things to patients. It just gives me little tips and ways to think about stuff when I'm trying to think of it through the lens of a parent of a child with type 1. So that's kind of the ones I actually listen to more. I'll go back and sometimes listen to the story ones, but I actually like the educational ones best.
Very touching, because I think of you as a very tuned in, thoughtful, progressive endo.
Yeah, I would consider myself that, yes. So
you won't know this till I tell you, but you're one of my measurement points for me. When I'm quietly trying to decide if I'm doing the right thing, if I'm, making the best use of the platform I have, all that stuff, I think Jessica is in my Facebook group a lot, and she seems to agree with me. So
yes,
awesome. So I take that as I'm doing okay.
Yes, no, you're doing great. I think you offer. Yeah, it's all these families, because I don't have type 1, nor do my children, but I just think I always tell families, like, I literally just saw a new onset diabetic today in the hospital, 14-year-old girl, and it's no family history like this. And so, they kind of blindsided. But I was telling mom, I'm like, the parents, I don't know if you listen to podcasts, but there's a podcast. So we actually have it. All of our new onsets get like a folder with tons of, information. And I have one page is like books, podcasts, and Facebook groups to join. And like Juicebox Podcast is on there. And then I have Sugar Surfing and the Dr. Ponder's like page, which you've had him on your show before. And we have like a Georgia type 1 diabetes Facebook group for like support group for Georgia. So I tell families to jump in there, but I really think it just connecting families. And I always, when I tell families about your podcast, I always say like, his daughter was diagnosed as a toddler. She's now in college. Like he's been doing this a long time. And, just kind of tell them, there's the new onsets. I always say, hey, go in the Facebook group. They have a list of all the episodes to listen to, for new onset from the beginning, just so you can wrap your brain around like, what type 1 is and how insulin works. I said, because, obviously they get education in the hospital, but that's like 2 days. And then they go home and it's like, you just got this life-changing diagnosis. And if they have no family history of type 1, it's a lot to take in such a short period of time. And there's so many nuances in managing it that you can't, like isn't going to be kind of explained in the very beginning. We're trying to just teach them like survival skills to get home, safely. And then once they're home, then obviously that's when they start learning all the like more nuanced things that they'll hopefully pick up on over time.
It's funny. The first question that pops up that you don't have an answer from that hospital visit, and it hits you like a ton of bricks. You're like, oh, I don't know anything about what I'm talking about.
Yes.
Yeah.
And actually we have like a really cool setup here. So I'm in Georgia. I'm in like a smaller, like academic facility. And so we have like residents and stuff like that. But we actually, when patients go home, I have a nurse practitioner that works with us virtually. She used to be, works in the hospital. So she worked a lot with our diabetic families in the hospital, but then now she's all virtual. And so when they go home from the hospital, they usually see us in the office in about a month. But up until that appointment, they have virtual visits with this nurse practitioner. So that way they literally kind of have her like almost at their disposal that first month to ask all the like, silly questions that they can think of, just like, just any little question they can think of. And then she'll review their numbers and adjust their doses and just like helps them kind of, by the time they get to my first appointment, I feel like they're all in a lot better place, like just understanding and just from a mental standpoint, just like a mental health standpoint, just they've had that like hand holding for that first month, which has been really awesome. So, it's been
this setup. You like it?
I love it.
Yeah,
it's so amazing.
And you're seeing dividends from it.
I know the parents. I mean, it's hard to, one of the things initially, the idea was like, oh, like let's see if this like decreases like DKA. I mean, the thing is like, majority of my new onsets aren't like back in DKA in a few months. I mean, hopefully not. But, we have obviously frequent flyer, kids that come in DKA. But for the new onsets, I think it's more so the benefit I see is that the families feel more comfortable with the diagnosis. The first visit in the office post, discharge, I think goes by smoother. And because they've already gotten a lot of their questions answered, and they just feel, and our nurse practitioner that does the program, like she's great with them. And, she hand holds a lot, which, is for people who are listening that are an adult diabetic versus a peds diabetic. Peds and adult world is very different in endocrinology. Like in peds, we do a lot of hand holding, and in the adult world, sometimes I feel like it's sink or swim. Like, if you're not going to put the effort in, then the provider may not put the effort in. Not everybody, but in general, when I talk, to friends who go to adult endocrinologists versus like how I know we operate in peds, I do feel like in peds, we do a little bit more hand holding because it's a lot, because you're not dealing with just the patient, the child, but it's also the parents, and that adds in, another level of dynamics in addition to like, puberty and all the stuff, the social, stressors that these kids have at school and things like that. So
when I should ask this, did you listen to the Grand Round series? Did it bother you, or did you like it? Did you not hear it? Today's episode of the podcast is sponsored by Dexcom, and I'd like to take this opportunity to tell you a little bit about the continuous glucose monitor that my daughter wears, the Dexcom G7. The Dexcom G7 is small, it is accurate, and it is easy to use and wear. Arden has been wearing a Dexcom G7 since almost day one of when they came out, and she's having a fantastic experience with it. We love the G6, but man, is the G7 small. The profile, so much closer to your body. The weight, you can't really feel it. And that's coming from me, and I've worn one. I've worn a G6, I've worn a G7. I found both of the experiences to be lovely, but my gosh, is that G7 tiny. And the accuracy has been fantastic. Arden's A1Cs are right where we expect them to be, and we actually use the Dexcom Clarity app to keep track of those things. That app is built right in to Arden's Dexcom G7 app on her iPhone. Oh, did you not know about that? You can use an iPhone or an Android device to see your Dexcom data. If you have a compatible phone, your Dexcom goes right to the Dexcom app. You don't have to carry the receiver. But if you don't want to use the phone, that's fine. Use the Dexcom receiver. It's up to you. Choice is yours with Dexcom. And now that choice includes direct to Apple Watch. Dexcom.com/juicebox.
I listened, the one that you did recently with another Peds Endo, I listened to that one, which is after I listened to that one, that's when I emailed you and was like, hey, let's schedule something. I've been saying for like 2 years, like, hey, we need to do an episode. So I've heard, like, I haven't listened to like every episode, but I have listened to quite a few of those. I don't really get bothered by, on the Facebook group or when y'all talk about it on the podcast, when people when people take like hits to the doctors, like when they basically like, oh, my doctor's stupid. They're saying these stupid things. I don't personally get very offended from that, or even you and other people like stressing, like advocating, parents, or if they're an adult type 1, like advocating for yourselves, like, hey, if you want a pump or you want this, like advocate for yourself. Like, I don't really get offended by that personally. The only thing I laugh at is when posts like, oh, like I asked my doctor for whatever, an Omnipod, and they only want to prescribe me Tandem. Like, they must be getting paid from Tandem. I'm like, y'all are funny. Like, yeah, we don't get any kickbacks from anybody. Like, trust me. Like, if you're in Peds Endo, it's because you enjoy Peds Endo, because
just because, like, listen.
Yeah. No.
I'm not saying I'd take a kickback, but I've never been offered one.
No, I mean, the biggest kickback I'm getting is like, I get like a free lunch, every few months when they come and, like tell us about whatever new thing is going on with their product and update us on what's going on.
Can you imagine if someone was like, I want an Omnipod, and you're like, nope, I'm giving you a T-Slim because I got a ham sandwich 4 months ago.
Exactly. I mean, we get like Olive Garden sometimes, like, it's, we're fancy over here. So, like,
I didn't know I didn't know they were handing out diarrhea to the doctors. Never mind.
Yeah, exactly. Yeah. So there is, no kickbacks, especially in Peds Endo. And really, I mean, honestly, in pharma, there is like that all got, years ago, a long time ago, before my time as a physician, there was a lot of probably shady stuff going on, but they can't even give us free pens. And
what is that called now? Is it the Sunshine Act? Is that
like that?
Is that what that is?
They really, and they actually keep track of all that. Like, I think you can actually look up like any provider and find out like how, even like for meals, like, because every time we get a meal, we have to sign that we accepted the meal. And so I think there's like somewhere you can look up to see like how much any provider has like gotten, even if it's like meals, like just the money value that they've gotten from like every different company or something like that. But
yeah,
I think for me, like when it comes to like that stuff, like the technology stuff, like pump type, for the most part, like I'll give people what they want. There's sometimes I think there's some pumps, because all the pumps are a little different. So there's some pumps that work better. I think would work better for certain patients, but in general, but yeah, I don't get upset when people talk about, I say bashing doctors to an extent. Like, I think, because I do know that there are some patients that are not listened to or not heard. And I get why families get frustrated.
Does it feel like bashing to you when you read it, even though you're not upset by it? Or do you see their perspective?
I see their perspective, but I could understand where the other like other providers who maybe, I think some providers are just very like, I'm a doctor and I know everything, and you're just a normal person and, don't know what you're talking about.
I love your doctor voice. Hey, can I ask you a question? Are you nervous or do you just talk fast?
I just talk fast.
Okay. I know. Don't be sorry. I think this is the first episode people might be able to turn the speed down on. Fascinating. When I think that you speak quickly, you speak quickly.
That's funny. Okay, I'll slow it down.
If I no, when I hear somebody go like Scott talks a lot, I'm like, I do. And then when I get into a conversation, I'm like, I can't even get into this conversation. I'm like, my God, these people are like professionals. You can keep me out of talking, then you're doing something. But I love all your don't curb yourself. Like I like what you're saying. I just want to tell people real quickly, the Sunshine Act is officially known as the Physicians Payments Sunshine Act in the U.S. It's a law that aims to increase transparency in the financial relationship between healthcare providers and pharmaceutical manufacturers, enacted as part of the Affordable Care Act in 2010. It goes on and on. You can totally Google it if you want to understand how it works.
Yes.
But I think prior to that, a lot of those lunches happen on Waikiki. You know what I mean?
Oh, yes, yeah. For sure. And like the golf, like, I mean, I'm not a golfer, but like, yeah, like, oh, let's go play some rounds of golf and, hear about, whatever.
Exactly. This is a famous golfer. He's going to play with us today. Can I tell you about our insulin pump now?
Exactly. Yeah. Yeah. That doesn't happen. I did get, this is not a kickback. This was really cool. My, T-Slim and Dexcom rep, both of them nominated me to go to their facilities out in California I get to go and tour both of the facilities.
Oh, cool.
Because they're both really close to each other, and get to hear, like, I guess, I don't know what they're going to tell me, like, I guess, hear all the new stuff. I don't know, but both of my reps nominated me. So I do get to go to that. So I am excited about that, but that's like literally go there, see it, and come back the next day. So.
Yeah. Oh, yeah. You're not going to be luxuriating in San Diego for a couple of weeks.
No.
Let me ask you a question. In the course of a year, rough number, how many people with diabetes or families do you talk to?
Gosh, like talk to?
So I'm going to assume one person you see a couple times a year. So don't count them 4 times. Count them once. Yeah.
Okay. So in a given week, my schedule template for my clinic, I probably have about 15 to 20 diabetic patients. That's type 1 and type 2 a week.
Wow.
I know last year we had a little over 80 new onsets admitted to our hospital, which we admit all of our new onset type 1s because of just the amount of education. And then we admit any presumed type 2 that's going to need insulin. So if their A1C is greater than 10. So we admit all of those just because of the amount of education. And I serve a rural area. So a lot of patients live 2 and 3 hours away and don't have, local hospitals or local hospitals that are mostly adult focused. And so we just feel safer admitting them. And that's 80s, that's type 1 and type 2. We have seen an increase in type 2 diabetics and in pediatric patients in the last few years, especially post-COVID. We also get a lot of new onsets in the clinic, mostly type 2s that are not on insulin that we see as new patients. So the numbers have been, I think I started where I'm at now in 2019, right before 6 months before COVID hit. And I think at that point it was about 60 new onsets a year admitted. So we've been slowly increasing.
I see. So tell me something. I'm trying to figure something out. I'm trying to figure out how much information that goes into people's heads ends up coming out in their management. Meaning how many people take seriously what they heard, put more effort into it? Because if you see 80 people a week, then just based off of you, my podcast should be bigger than it is. And you're not the only doctor out there whispering in people's ears. You put it on a pamphlet, which, by the way, I really appreciate. But you know what happens in the hallways at a lot of the offices? While they're walking in or out, the practitioner will grab you and go, juiceboxpodcast.com.
Yeah.
I know what the guy in there is about to say to you. Go find a Facebook group called, you know what I mean? So what's that like being a doctor, knowing that you're going to talk to 80 people and only a small percentage of them are maybe going to elevate from what you've said to them?
Yeah, it's definitely, and I think I mean, I'm sure in the adult world it's very similar, but in the peds world, there's so many dynamics. And also for me, particular, the patient population I serve, there's a lot of, for instance, a lot of my families, I'm talking to a mother who is a single mother with multiple children, working 2 jobs, and has, grandma and aunts and uncles and friends and just older siblings that are helping to care for their child with type 1. And so whether it's diabetes or say they're coming for prediabetes and obesity, sometimes I feel like I try to be realistic in I want to give them the information, but just to be, when I'm realistically thinking, when does this person have time to sit down and,
Yeah.
so much of our families, they are living in a constant state of trauma and flight or flight mode, 24/7. So, and then you added on this very, big chronic illness on top of that. And so I think that's a lot of it. And so it can be frustrating, and it can be disheartening and sad especially when we have the patients that come in, multiple DKA episodes a year. And, every time you see them, it's still A1C is greater than 10. And you feel like you talk to your blue in the face, and it just seems like nothing's getting through. I try to simplify management as much as possible for families, especially if, either maybe education level isn't as high, and or they just can't. There's too much going on in their life, and they're just worried about can I put food on the table and a roof over my kid's head? So it's
hard to worry about 30 years from now when you're not 100% sure that on Friday the water is going to be hot. This episode is sponsored by Medtronic Diabetes. MedtronicDiabetes.com/juicebox. And now we're going to hear from Medtronic champion Jalen.
I was going straight into high school, so it was a summer heading into high school.
Was that particularly difficult?
Unimaginable. I missed my entire summer. So I was going to a brand new school. I was around a bunch of new people that I had not been going to school with. So it was hard trying to balance that while also explaining to people what type 1 diabetes was. My hometown did not have an endocrinologist. So I was traveling over an hour to the nearest endocrinologist for children. So, outside of that, I didn't have any type of support in my hometown.
Did you try to explain to people, or did you find it easier just to stay private?
I just held back. I didn't really like talking about it. It felt like it was just a repeating record where I was saying things and people weren't understanding it. And I also was still in the process of learning it. So I just kept it to myself, didn't really talk about it.
Did you eventually find people in real life that you could confide in?
I never really got the experience until after getting to college. And then once I graduated college, it's all I see. You can easily search Medtronic Champions. You see people that pop up and you're like, wow, look at all this content. And I think that's something that motivates me. I started embracing more, how I live with type 1 diabetes.
MedtronicDiabetes.com/juicebox to hear more stories from the Medtronic champion community.
Exactly. Right, and that adds a whole nother level of just nuance with patients. And I can't remember, there was one episode, I can't remember what episode it was. And I was thinking about it and even talking to my rep with Tzield. Tzield is the newer infusion that recently got FDA approved. Well, it's been over almost 2 years now, I guess. FDA approved that if you catch someone that has 2 antibodies or more for type 1 and they're in that pre-diabetes stage, you can give Tzield, which is a 2-week infusion. It's a 30-minute infusion. And the hope and what the clinical trial showed is that you can delay onset of type 1.
Yeah.
So I have not personally been able to give it yet. One is finding the patients, and 2 is just logistics, because it's every day for 2 weeks. So, and even talking to my rep, I was, saying really hard. Again, I serve a rural part of Georgia. So when patients live 2 hours away, one, I'm going to give this in the hospital. I'm not going to do this infusion at home. I don't feel comfortable doing that yet just because of the side effects I can have.
Yeah.
And they, again, if people live, really far from a decent, a a hospital that I would feel comfortable with them going to. So it's like, then again, how do I, if I have a single parent that has other kids and then has like a job where she doesn't get PTO, then it's like, oh, hey, come here for 2 weeks straight for a 30-minute a day infusion. It's like it just, how is that going to work logistically? Like it just, and so I was telling my rep, I said, I feel bad. I said, because I feel like it almost feels like it's an injustice of who can even have an opportunity to probably use this because of just the dynamics of like their social situation. Like I just don't know how to do it.
It's an inflammatory word, but this is where your privilege comes in.
Yes, for sure. It's
if
privilege.
You have it. Yeah.
Yes.
And I don't,
for sure.
Listen, I don't mean privilege in the zeitgeist overtone that's going to make half of you pissed one way and half of you pissed the other way. I'm just talking about like the opportunity or like I interviewed a lady one time. I don't know that it's ever going to be on the podcast. I'm trying to get it on. She got a job and the job's trying to block her from being on the podcast. But
oh no.
But and she said like, the Tzield infusion, it was here. We got a hotel. We stayed for a week. And I'm like, yeah, that's already more than most people can do.
Oh yeah.
Yeah. And like, so that's the kind of stuff that you don't understand. The reason I'm asking you about it is because you're in a unique situation. Like, good information to tell people and you're willing to tell them about other stuff they can go find on their own. Mm-hmm. And yet you're having the same frustrations. You and I have the exact same professional frustrations. Like, unless I'm wrong, and I'd love to hear from you on it, but I think you go listen to that Pro Tip series, you'd have to really not understand it, not to end up with an A1C in the sixes in the next 6 months or a year after that. Do you think that's reasonable to say by me?
Again, I think if you have, like, use the word privilege, if you have the privilege to sit down and listen to a podcast.
Yeah, for 24 hours. Yeah.
Absorb the information, be able to apply it, knowing, again, that like it's not just you, there's other caregivers involved, then yes, I think because I have patients who, again, probably do have more privilege, like that they have listened and they have been able to apply and, they're doing great. They can get these, amazing A1Cs like in the 5s and 6s.
How do you make the time and the space for that if you are running from one job to another and then home and then
it's just, even for me personally, like just, between like I have three young kids. So 3 young kids, full-time physician, and then like amongst other things. And then, even try to listen to like, I'm in this like parenting coaching group that I like pay money for. And like, it has all these lessons about like,
really?
More of like a gentle, conscious parenting. Cause I've been trying to like adopt more of that in my parenting style. And like, I've been in this program for like 2 years and I barely get to listen to all the episodes and that I'm paying for because I just don't have the time. So like, I can't imagine like.
What was your parenting style like that got you to want to join the group?
I didn't really have one, but me and my husband were raised like very differently. So like, most of that's like the gentle, positive parenting is more about like connection. Over like the shame and guilt that we often do in parenting. And honestly, part of it, I feel like a lot of times with my families, with, parents, especially in the teenage years, and maybe you can speak to this with you and Arden, but the teenage years can get really rough, and when the kids are more independent and they're more out on their own, but the parent still wants to control a lot. And, when I have families coming in and it's like, the kid is like, never bolusing, I give them all the, they have all the technology, they have the pumps, they have the sensors, but they're just like not doing squat. And, the parent and the kid are always fighting, and I hear, half the visit is the parent just like throwing the kid under the bus to me the whole time. And like, oh, tell her how you like keep sneaking snacks and tell her, whatever. And so like,
is that how they go? Is that what happens?
Yeah.
Oh my God, people, listen to me. You're all such terrible communicators.
And so it's always this weird dynamic. Or then especially when you add driving into the mix, it's like, because as a parent, like if my child was type 1, like I would like, really be worried about them being behind the wheel. Obviously probably more for hypoglycemia than hyper, but sometimes when your blood sugar is really high, you are not right in the head. Like you feel really, affected by that too, mentally, between driving and just privileges and like, or I'll struggle with like, oh, they get things taken away because of they're not managing their diabetes. And when I compare that to like the things I'm learning with like more of the like positive conscious parenting, I'm like, I don't know if that's going to help, but I don't know, like it's hard because I'm like, I'm not the parent of a type 1 but I just, in my head, I'm like, I don't think that's going to work, like taking things away from them or not letting them go out with friends. But then I still am personally still trying to figure out like, how can I help these parents, especially of the teens? Like, how can I help them get through this rough patch? Because I feel like it can be, and I mean, it's frustrating for me as a provider because I'm like, their A1C is going up, their parents, the kids getting older, they're more independent. But it's like they want to be more independent, but they're not doing it. So then it's like, okay, well, where does that like, sometimes I try to approach the kid and I'm like, hey, like,
your mom seems crazy. What
yeah, like when you're home, like why don't you just like let your mom do it? Like if you're on the pump, like if they're on the pump, I'm like, if you're home and y'all are about to eat dinner, like just let your mom do it for you. Like, but it's like again one of those things where like the mom is texting or asking the kid like, what's your sugar? Did you give your insulin? Your blood sugar's going high, or did you treat your low? And it's like, the kid is like frustrated and it's this battle back and forth. And sometimes I'm just like, I don't know what to tell this parent or this kid. Like, how can
Hey, listen, one time Arden pushed back on me and I sent her a number and she goes, and it was like a dollar number. And she goes, what's that? I'm like, that's how much college is going to cost you if you don't change that pump right now. Because but we also have we have a similar sense of humor. So I think it helps too. I mean, listen, if you're going in the doctor's office and making Jessica judge, jury, and executioner for the things you can't get your kid to do, that is not going to be a winning formula.
No, it's usually not.
Yeah.
And I'm like, and I try to make the kids feel better and the parents like, listen, like you're not the only one. Like your kid isn't the only one that like eats food and doesn't bolus and doesn't tell you they eat. Like this happens.
This is regular kid stuff.
Exactly.
But it's magnified because of health.
Exactly.
Otherwise, you would ignore it. You'd be like, stop playing Call of Duty. And they wouldn't stop. And you go, yeah, he loves Call of Duty.
Exactly.
And then that would be the end of it. Or I wish they'd stop looking at TikTok. I told them not to, but they're not going to. And then 30 years from now, when something happens, you'll be like 70 and you'll be like, I tried my best.
Yeah.
Like,
exactly.
right. Yeah.
But when it's their health, like
feels very immediate.
As a parent, I get it. You feel.
Jessica, do you know the funniest thing you've said so far? We've been talking for 28 minutes and 41 seconds.
What is the funniest thing I said?
I'll slow down.
No, I didn't slow down. I think I did slow down for like a few minutes.
That's my favorite part so far.
I talked about Tzield, I slowed down.
Because you were like, oh, there's things legally I have to say here, I think. Well, listen, let me say this, because I tried to jump into that part of the conversation. It did not work for me. Screen It Like You Mean It. By the time this episode comes out, there'll be sponsors on the podcast. And it's screenfortype1.com, SCREENFORTYPE1.com. Screen It Like You Mean It. It's for, I don't know how I'm like allowed to explain it, but I think it's a public relations movement to talk about the importance of screening your extended family for type 1 diabetes. But you'll hear those ads throughout because they're on, I think, a completely almost impossible journey. Like they're going to go tell you, hey, listen, does your kid have type 1 diabetes? You should go tell your sister and her kids that they maybe should get screened for type 1, which by the way is great advice, right? But man, how do you get people to do that? Like based on your conversation about how we can't even find time for people to go listen to a podcast. Like how are they going to go get screened for type 1 diabetes when that doesn't seem like one of the top 100 things on their list today?
Yeah. Well, and then honestly, even parents of some of my type 1s, when I mentioned about screening the siblings, I have some that they just don't want to know.
Right.
They would rather just watch for the symptoms, which again, if you have like a parent who's paying attention and has the ability to pay attention and recognizes the symptoms early, then, but even then, by the time you're having symptoms, you're going to probably be already past the point where you could get the Tzield because you have to be like in that pre-diabetes range. And so, I mean, I get it for some parents, knowing the other kid has an antibody is more nerve-wracking and anxiety provoking than not knowing. Again, everybody's personality is different.
I think it's all about your level of anxiety and how it screws with you because because anxiety could make one person say, I have to know. And that same and anxiety touches the different person slightly differently, makes them go, I can't know that this is coming. It's interesting.
I tested my son, even though we have no history, but he was 6 or 7 at the time, but he had like wet the bed a couple of times, and it was not, he had not done that really since he had been potty trained, and I was like, what's going on? And so one day he was in my office, and I checked his A1C on our like point of care machine in the office, and it was 5.7, and I was like, why do you have a 5.7 A1C? Like, that makes no sense. So then I ordered the kit that at that time, I think it was maybe Enable Sciences. Like, you could order the kit. They mailed it to your house. You did a finger stick, and you just had to put like 3 blots of blood on the little card, and you mailed it back, and they checked, I think, 3 of the antibodies, and those 3 were negative. So I was like, okay, like, and
did you figure it out ever?
No. And actually I repeated his A1C, and it was like 5.6, which still, I'm like, you shouldn't have a 5.6 A1C. One day he did something else that, like, even after I had the antibody results back, I can't remember if he was like just peeing more or drinking more, or something about him just seemed off. And I was at home, and it was like the day before we were going on vacation somewhere, and I grabbed his finger, and like I had a meter at home, and I just was like, no, let me just check your blood sugar. And I stupidly did not wash his hands before I did this. And I just like grabbed it and poked it, and it was like 390. And I was like, my heart like stopped. And my husband, I'm pretty sure, like walked into our bedroom and was like praying. Like, he like was so scared. And then I was like, no, let's go wash your hands. And anyway, he washed his hand, and we rechecked it. It was like 94. I was like, okay.
Hey, could he have anemia?
I'm trying to think if they would have checked that at his last primary
Who's they?
care.
Aren't you a doctor?
Well, like his primary care. Yeah.
I mean, I heard you just slipped into the A1C machine one day. So like,
I don't know. I'll have to they can probably check when he actually has a checkup coming up next week. So
I asked our overlords, ChatGPT 4.0, can children have an elevated A1C and not be diabetic or pre-diabetic? Yes, children can have an elevated A1C and not be diabetic or pre-diabetic. Hemoglobin variants, iron deficiency, anemia, chronic kidney disease, stress and illness, medication, or laboratory error.
I mean, and really, like A1C, I mean, it really isn't like the best test. It really, time and range is like a better. Did you ever throw a CGM on him? Well, I tried to put one on him, but he was not having it. They've seen me wear them because I've worn all of them just to try them out. And so they've seen me wear it. But when I attempted to put one on him, he ran circles around the house and was screaming. I was like, okay, fine.
Hey, when you said you and your husband were raised differently, can you give me context for that?
More just like he grew up more like in like his parents would use like spankings, and my mom was not a spanker at all. My mom was more like,
I love you, Jessica. Why are you doing this?
She would just fuss at you, and then like she was just tired. Like, she worked and had 3 kids. I also am a lot older than all my siblings, and so honestly, I was a pretty good kid. And once my siblings came, I was like another little mom. Like, I helped with the kids and babysat all the time. So my mom could just use like a tone of voice with me, and I would cry. So like she didn't really have to like do much, I mean, maybe like once I was in high school, I think I got grounded a few times for like going to a party when I said that I was going to be at a friend's house or something like that. But in general, like, I was a pretty good kid. So
gotcha. Not a lot to do for you. Okay. Let's see some stuff. Like you just said, I'm open to talking about anything: looping, pumping, diet, thyroid, working with families, etc. Okay. So let's pick through this list a little bit. How much time do you have for me today? By the way, how much?
I'm good.
Oh, yeah. Okay.
I'm fine.
Arden, by the way, on her way home from college right now. She's driving home from Georgia to here as we speak.
Gosh. That's a far drive.
Yeah, I think she just got into South Carolina because she just left about an hour and a half ago.
Did she have to pack all her stuff? Like for home for the summer?
Her boyfriend flew down, helped her move into her next place for next year.
Oh, fun.
Yeah, and then he's going to tandem drive with her on the way home. She's exhausted. She's been doing all-nighters for like off and on for like a month and a half getting through her finals.
What does she want to do when she's done? Like, what's her dream job?
I think she wants to design her own line of clothing and manufacture and sell it herself in a like maybe a small setting.
Cool.
Yeah, that's her goal. But She's where you are right now, is what I was just getting ready to say.
Yeah.
Just a little east, maybe.
Yeah.
Okay, so let's pick through your list. Let's go to pumping first.
Mm-hmm.
So do you put families on loop, or do they come to you and then you go, that's fine with me if you want to do that, but I have to tell you legally that I can't support it? Like, how does that all work?
My first looper was, so it was actually the dad and his son both had type 1, and they were both on Omnipod. This was pre-Omnipod 5, and he was getting ready to, like, he had another year before he was going to college, and mom was like anxious because she wanted him to be on a closed loop system. But Omnipod 5, in the beginning, it took forever for it to come out. It felt like, it was like, when is it going to come? And so she was just like, I don't feel like waiting anymore. And I had mentioned looping to them. The dad is an engineer, and the patient, like, he also, like, he's at Georgia Tech with doing engineering. So both very, very smart. And like, I was like, there's this looping thing. And so they looked it up. I think the kid and the dad built it themselves. And so he was my first looper. And then after that, I had another family who, because they had really crappy insurance, they were using the Libre because the Dexcom was too expensive for them as for the out-of-pocket costs. They use the APS system, and so they could loop with the Libre, and they have this little thing called the bubble that they put, like, that the Libre, like, goes around the Libre, and that would allow, this was on the Libre 2, that would allow the Libre 2 to, like, talk to the APS app.
Oh, geez.
So they loop, and his dad is, like, in the medical field, like, he's a PA, I think. So he was, they're very, like, the parents were like, they understood how insulin worked. So, like, and honestly, because the APS system and the looping, like, on the iPhone is a little bit different. And so honestly, like, I feel like they understand it better than I do, because I can't go through, like, all the pages and books and all the education they have to do to, like, learn every little intricacy of the system. And then I have recently, in the last few months, put a toddler on loop. And that was, again, I suggested it to mom. And then I have another family. The mom is a math teacher. They were on OP5, and she just wanted more control. So I was like, why don't you do looping? They actually ended up using, is it T1 Pal, I think is the company, and they, like, helped them. Yeah, they, like, they build the system for them, and like, help them get set up. And then she ended up paying, like, extra money to do some sessions with somebody from Integrated Diabetes, I think, where Jenny works. Yeah. After she started looping, and so
that's how she got set up.
But
there you go.
4 loopers.
Speaking about having, like, opportunity, can afford to become an app developer, can afford to, or to pay somebody to do it for you, can afford to call Jenny and have her explain the whole thing to you. That's probably, I'm guessing $1,000 to $2,000 of, extra income to get set up on this thing.
Yes, for sure.
Yeah. So there's varying levels of people's abilities, right? Varying levels of their effort, their understanding, etc. You have to assess those people. Do you put them on a pump based on that? Like, do you know what I mean? Like, do you look at somebody and go, you're not really going to be that involved with this, take the Omnipod 5, or you're going to probably want to be more aggressive, why don't you try Tandem? Or you're never going to count a carb right. Have you heard of the iLet? Like, is it going like that?
Yes. And then some people, some people, like I said, come in and they already Googled stuff, or, the kid's been on TikTok or something, and they already have, like, decided they want something. Usually it's probably the Omnipod because it's tubeless, but it depends on the family. Like, if somebody, basically just what you said, like, I have patients who, now that iLet's out, I have a handful of patients on the iLet now. If they were not carb counting, like, I already had them on, like, a set dosing regimen because they weren't carb counting, and, they chronically have not controlled their diabetes well, then I've been, like, kind of showing them the iLet. Most patients I show iLet mine, I was like, I don't actually have anybody on Medtronic. I have not been a huge Medtronic fan so far in my career.
Have you seen the 780G?
I have not used it. I have seen it.
But it's still, in America, it's still using the old CGM though, right?
I think it's, I don't like the CGM. I don't like that you have to, like, charge the transmitter, and then it's, like, all that weird tape that you have to put on it. I mean, I know you don't have to, like, calibrated anymore that, like you used to. But I think for me, even when Medtronic first came out, I felt like it was false advertisement because you still had to calibrate, and it really, I just did in the pediatric world personally, people that were on it, they were very rarely in the like auto mode or whatever. I felt like they were getting kicked out all the time. And so they weren't really getting the benefits of an AID pump anyway. And so
I think when Medtronic when they're going to really like blaze back into this, it's going to be when their newer CGM comes out in America and they pair it with a 780G. I think that's when people will take it seriously again.
I mean, I've seen there's been some guy that's been posting in the Facebook group about the 780 and how much he loves it. And I've seen pictures of his graph, and like it looks promising. I mean, from my understanding, their target goes down to 100, which is the lowest, on the market outside of looping. I think just because I hadn't really been working with it much, I just have steered away from it in general. But
by the way, shout out to Bill, whose name I know because I know who you're talking about, because he does post about it all the time and I always see it.
Yeah, and it looks good. I mean, I'm like, ooh, that looks good. Anyway, so usually I would show patients, show them the Tandem, show them Omnipod, and like, okay, which one do you want? Some patients, I'll tell my diabetes educator, like, hey, like, just show them the iLet because like there's no way they're carb counting. I do feel like as far as like the carb counting issue before the iLet came, I do feel like Omnipod 5 is a little more unforgiving for patients who struggle with doing that because
with carb counting,
once you're too high, well, like if you're not announcing meals or like really off on your carb counting, because if you stay high for too long, it will kind of force you into manual mode.
Jessica, let me ask you a question, because that fries my mind. People don't bolus their meals regularly?
No.
Oh. Okay.
Yeah.
I'm so used to talking about it the way that I know works and the way we do it. And I have to tell you that one of the things that I get shocked about more than anything, put all this kind of high-minded effort into this podcast and all this, like, here's the variable series, defining, because if you understand the definitions, you're going to be able to do it better, blah, blah, blah. And people come to me, they go, oh my God, I'm doing so much better. I go, what did you do? They're like, yeah, I'm pre-bolusing my food. I'm like, wait, that's it? Like,
yeah, they just...
Yeah. Like some days it feels like the podcast could be 3 minutes long, one episode, and I'd reach just as many people. And
yeah.
But so that's not just me. This is what you see too.
Oh yeah. I mean, it's a lot. I mean, again, especially in the teenage years. I mean, whether it's the kid, like a younger kid who just like gets into snacks and doesn't cover, or like the teenagers who they just eat and don't bolus. They wear the pump and they just let it ride and hope the basal covers it. And so the way that Omnipod 5's algorithm works with like the learning, and so they get kicked into manual mode. And the one thing I keep telling my rep is like, when it forces them into manual mode from a high, then it doesn't alert you that you're like still in manual mode. So like I'll look at the report and they'll be like in manual mode for days, and they're sitting there wondering like, why am I still high? Because the pump isn't, obviously adjusting for the high, because they don't realize that they're in manual mode. And so,
do people not know they're killing themselves? How do you stop yourself from saying it?
I mean, we talk about the effects of uncontrolled diabetes, and honestly, like especially with my teens, like a lot of times the parents will be like, they'll have, maybe family members that are like type 2s that have like lost limbs and are on dialysis. And so sometimes the parent will be like, like, oh, like you're gonna die, or you're gonna you're gonna have dialysis. And sometimes I'll use that. But personally, like, again, like the teenage brain in particular, well, like all kids, but like teenagers in particular, one, they're in that phase of like thinking they're invincible.
Right.
Two, their like frontal lobe is not developed enough to like understand like future consequences. And so for the most part, to me, telling a teenager who's not controlling your diabetes about like, oh, you're going to die, or you're going to lose your, your toes or whatever, like that probably is like literally, it's like Charlie Brown, like, wah, 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 wah. Like they're not hearing me. What I do try to bring up in kids is like, especially if they're athletes, like, hey, like if you want to be stronger, if you want to be faster, especially like the boys, like if you're trying to gain muscle, like you're in the weight room because you play football and you're like not picking up muscle mass, you need to take your insulin. Like the glucose cannot get into your muscle cells unless you take the insulin. The insulin is the key to open that door. And so I try to like focus on that. And then the other thing I sometimes mention to teenage boys is erectile dysfunction.
Yeah, like, that'll get you moving.
Yeah, hey, like, I mean, I'll like always preface it, like, I'm not condoning like, sex in your teenage years, but like if,
I'm trying to imagine me being like 16 in my office and my doctor looks up at me and Jessica's like, hey, you want a boner? Is that it? Because it ain't going to happen. And you're like, oh, wait a minute. I didn't know we were talking about important stuff here.
Oh yeah. I'm like,
would it be quicker to tell them that a high A1C makes their PlayStation not work? Like, would that be fair? Like, because as you're sitting here talking, right, I know this. I understand the nature of man. I know the seasons of growth and understanding in your brain and your understanding of life and your desire. I mean, listen, you hear me. I tell people all the time, people help each other, help themselves normally for other people before for themselves. Like you have to go through these, have experiences so you understand, and hopefully you'll be lucky enough to be, like still healthy to take advantage of these things you've learned. Knowing it and then hearing you say it is two different things for some reason to me. Like it just flipped me out and made me upset. I was like,
I can have patients. I have patients. I have patients that, I have been carrying them for years, and literally their A1C is greater than 14% on my machine every time I check it.
Kids?
A kid, yes.
Are their parents not involved?
Sometimes, but sometimes again, like it's the privilege thing. Like, I mean, they're there, but
so privilege runs beyond your ability to do, beyond your ability to afford something. And it might run into like, do you have the privilege of having a parent who is interested enough, intellectually minded enough, et cetera, to actually help you with this thing?
Exactly.
Gotcha.
And if the kid, and it's not common, but there have been times where like, kids have ended up in foster care, but that ends up not lending usually any better.
Yeah.
Because they get put into homes where the person isn't always educated about diabetes. We don't always know when they're going to get moved to a new foster home to educate families ahead of time. And so it can end up being just as much of a hassle, for the kid. And then, that adds the whole nother like social dynamic of now you're like with this person that's like a stranger and you're taken away from your family. So then you're not happy about that.
How often do you see desire without intellect? Like, I want to help. I just can't. I can't do it. I can't think my way through it. Is that common, or is it more common for them to have the ability but not the drive?
I think it's probably more they could have the ability, but not the drive. I say the ability, like I think they're like intellectually they could do it,
right.
But I think not lack of drive and just like, or lack of like, again, like if you are literally like, again, like I said earlier, like just trying to feed your kid and provide a roof over their head, you care about your kid, you love your kid, like they'll come to the appointments and you can ask them the questions and they can answer them. Like, even the kids, like, what's your carb ratio? What's your correction factor? Like, they can rattle it all. They know how to do the math. Like, it's not a lack of knowing. It's just like, they just,
I always think, like, what are we doing this for if we haven't future-proofed it? Like, why am I going to those jobs and exhausted and having these fights and standing in the grocery store at 7:30 and like, arguing with these kids and living in a place like, maybe I can't even afford. And I have all these problems in my life. And you mean I'm going to fight through these things to raise that kid to watch something terrible happen to it when it's 30? Like, what did we do it for then? Like but is that not, oh, I'm upset.
It's maddening. And it's just, honestly, it's sad. Like, and some providers like, may kind of like discharge patients, if they're just non-compliant. I, in general, don't do that. Like, because I'm like, what is that? I mean, it's not going to solve anything. I mean, I think sometimes like you may, as a provider, you may recognize like, okay, me and this patient and this family are not like clicking, like we're not on, we
could
just
happen, right?
Don't mesh well. Yeah. And like, you think, okay, another provider may be able to like help them better. In general, like, I mean, unless the family, if somebody's like being disrespectful to like my staff or like, whatever, then they may get discharged. But in general, like just for like, you can't get your A1C in control. I'm like, yeah, I mean, like, making you go somewhere else isn't going to solve the problem probably either.
You can't kick a kid out of class for not being able to fly. Like, you're trying to teach them something they're fundamentally not going to be able to do.
Yeah.
And so you then become their guide through as good as we can get it.
Yeah, essentially. And I just hope, like, honestly, I don't know if you follow, there's a girl on social media, her Facebook is T1D Chick. I don't know, she's probably in her 20s or 30s, but her and her brother are both type 1s. And I follow her on social media. And she talks about, like, when she was a teenager, she, had like greater than 10 A1C and just had those years where she was just like in a funk and just wasn't applying herself. I mean, and now she's, now she's pregnant. And so, obviously super tight control, but she's on a Tandem and she is like a, diabetes influencer now and, usually maintains an A1C in the 5s. And so, like, sometimes I see her story and I'm just like, I just in my head just think, please God, like, let that be all my patients that I have right now.
That's where I want them to get. Yeah.
Yeah. Like, hopefully one day, like, just that frontal lobe develops and, they just
take care of themselves.
And I think too, like, a lot of these patients, again, if you're like living in a lot of trauma and living in some ways, sometimes like a hopeless state, I think even for the kid, like, it's hard for them to understand like that, like, life can be better. Like, life, I mean, it's just, I think it's easy to get, like, if you, if like y'all struggle at home and then you have diabetes and you have people at school, like, teasing you, or like you feel different because you're wearing all this technology.
I've had my fair share of seeing some parents like say, like, I don't know why my kid won't do this. And I look at them and I think, God, if you were my mom, I'd give up too. No one ever sees themselves in these situations, right?
Exactly.
Like,
so I just think it's just hard for some of these kids. And I mean, just the mental health aspect, is a lot.
Is the answer for people finding themselves in that situation iLet? Is that the answer?
For some of them, I'm trying. Actually, like, I just ordered the iLet on 2 of my patients who are frequent flyer DKA patients, and again, like, A1Cs greater than 14, like, all the time. And I told my diabetes educator, I'm like, you know what? Let's just try the iLet. Like, at this point, what do I have to lose? Like, a lot of times, as an endocrinologist, when we're like assessing, is a patient pump ready? One of those things is like, well, if they're always like coming in DKA, you're hesitant to, and not paying attention, you're hesitant to start a pump because it's like, well, that could increase their risk of DKA if they're not paying attention to their Dexcom, like when they're running high and going through all, like, checking the ketones and changing your pump site, But
they're not doing that anyway, right?
Exactly. Yeah. They're not taking their long acting. They're always in DKA. So that's why I told my educator, like, at this point, like, what do I have to lose? Like, they're going to go in DKA again. Like, that already happened. I had this one kid, and I actually still see him, but he, like, always had an A1C above 10, and he was just like really quiet, like super introverted. And I was just like, the mom was a nurse, like, she, not a lack of education. And I just, like, one day I asked the kid, I'm like, dude, like, what's the deal? Like, he's like, I hate injecting myself. It hurts. I don't want, he would take his long acting, but he just, like, wouldn't take his short acting. He's just like, I hate injecting myself. But he wore the Dexcom. I was like, you know what? Let's try Tandem. And he's been on a Tandem now. I think we're going on 3 years with an A1C in the 6s ever since then. Went from above 10 to 6s. And it was just like, he just didn't like injecting himself. But once he got on the pump, I mean, it's like,
I'll do this.
Beautiful.
Yeah. That's what you're looking for. Listen, I think that's old timey backwards thinking about, like, if they're ready for a pump or not. Like, well, they're not doing this thing. You're not going to just try. Doesn't make any sense. Or there's the stories of when people have their pumps taken from them. I'm always like, there's nothing about that story that would make me think you shouldn't have this pump. It feels like knee-jerk reactions from doctors sometimes.
I did actually, like, about a year ago, I had one kid that I did tell him, like, we're done, because we literally went from A1Cs, usually, like, I mean, not stellar, but like 8s and 9s, but, like, started the pump and had multiple DKA episodes, and A1C went up to 14. So I was like, no.
You were at least you were injecting your long acting insulin.
Yeah. And so we ended up switching to the N pen. So I was like, that way I could still get the data, from the short acting.
So is there a piece of your mind that says, look, I can't save everybody?
I mean, yeah, I mean, I try, but like, I mean, it's just, you know, again, I literally always just hope like, okay, maybe like, it's like I'm planting seeds now and in the hope that like
They'll turn into that person who pulls it
they'll turn
together.
into that person that I can figure it out and, you know, and not someone who just, you know, continues down this path of just like, you know, and I think it's hard too, because that other thing I think about when I'm talking to my teenagers is like, okay, what's your plan for life? Like, what kind of job are you going to have? Like you have diabetes, like you need a job that has like good insurance because this is an expensive disease.
Yeah. Oh, you think a person who can't inject their insulin is planning for 10 years from now?
Well, no, but
Okay.
I just like, I start talking about it because I'm like, okay, what's the plan? But like, you know,
Yeah.
I mean, I do have those patients who like, or I have some, especially teenage girls sometimes are like this, like they are stellar in school, like straight A student, cheerleader, does all the things, but then like diabetes control, like they just can't pull it together. Like they just, you know, just don't bolus and whatever. I have that sometimes, but more often than that, the kids who are not managing their diabetes well are also not doing well in school and are also like struggling at home. You know, there's like family dynamics that are like, you know, not ideal at home. So it's usually like their whole life that's like struggling.
You know what I've noticed helping Arden, the dynamic settings in the IAPS are really valuable. Like adjusting her basal, her insulin sensitivity, and her carb ratio based on like perceived need, based on like the history of what's happening. I think that's taken another level of having to think about diabetes away from Arden. Like, I think it's what got her through her finals this last time.
I see what you're saying. Yeah. Because you can adjust all that stuff.
Yeah. Because it's easy to think like, oh yeah, well, Scott's kid does it. It's easy for him to say my kid won't do it. But there's plenty of times my kid doesn't do it. She boluses her food. That's a thing. Right. And she pre-boluses most of the time. So I'm happy. But if she's in the middle of a project in college and she misses a bolus and her blood sugar goes to 200, she's not correcting. But the algorithm corrects.
Exactly.
Yeah. And it's hit. And now fair, she believes it's going to do that now. So maybe she feels like I don't need to look. This is how this works.
Yeah.
There's probably been 5 times in the last 6 months I've texted her and said, please bolus whatever suggested insulin there is. Because this algorithm is never getting ahead of this with what it's trying to do. And I won't even get I don't even get a response. I just see on Night Scout that the bolus
that she does it. Yeah.
And I'm like, okay, good enough. But she's incredibly busy. Like I do want to point out that she is really busy, but you know, there could be other kids who are going to be, you know, really drunk or really busy or studying or like whatever. So like there's always levels of why am I not looking at this? And all this is, Jessica, this whole conversation is just about the way humans' minds work.
Oh, yeah.
It's all this is, right? So,
I mean, literally, I mean, you would probably cringe. Like, I mean, I can look, like, I will have some, you know, I'll pull up a Dexcom clarity report and literally it will just be like greater than 400 for like days in a row. And I'm like, I don't.
Why not? What, even like, once, just for fun? Like, just to wonder what would happen. They're literally not looking at all.
No.
Oh, okay.
So those are the patients sometimes, like, as far as like the pump candidates, like for people literally who I can tell, like, you're not even looking at your Dexcom. Like, I do sometimes get worried about putting them on a pump because I'm like, oh man, if they were uncontrolled but not in DKA a lot, then those patients I do get worried about because I'm like, okay, they probably were at least taking their long acting at least like half the week, you know, or something, just enough to keep them out of DKA. But like, if they're never looking at their Dexcom, I do worry, like, are you really going to change the pump and pay attention and, you know, troubleshoot it if you're...
Let me pivot here for a minute and ask you. So obviously what I'm hearing from you is that I have successfully found a way to reach certain people. And now...
Yes.
Is there something that could be done for those other people? Like, am I just not creating the right content? Like, is there a thing I say that if I said it differently or presented it differently... Or would they just never look, even if it was there? Like, how do you lead the horse to water? And once they get there, is the water that I have available the right water for them, or do they need different?
I honestly feel like that, like education, like the episodes like you and Jenny do. I mean, I feel like for the most part, those are very, I say, dumbed down. You know what I mean? Like in layman's terms.
Oh, and well, like, yeah, listen, I'm pretty dumb. I know what you're saying. Yeah.
You know what I mean? Like not in a derogatory way, dumb, but just,
I know what you mean.
it's in layman's term. It's not, it doesn't feel like doctor talk.
Right.
And so, I mean, I feel like from that standpoint,
that helps.
That part is fine. Again, it's just the broken healthcare system, and just like.
But is it, or is it just they're in a, like, I mean, you're saying to me that these people would magically respond if the healthcare system was different?
Well, broken healthcare, okay, not just healthcare, broken healthcare, but also just like a broken system. Like, again, when you talk about privilege and food deserts and racism and all of the things, like, I think that's where a lot of that can come in. And just, again,
that's not wrong, by the way, right? Like, even from a doctor to look at somebody and go, oh, I know you people don't do this, so I won't bother bringing it up. Like that kind of thing. Or I know how your people eat or something like that.
I mean, you have to ask, I mean, like, you shouldn't assume, but
it happens, right? Not for you.
Oh, yes, it happens. So that's even part of the issue. And that's where I even, like, when I was talking to my T-Zield rep, that's what, like, we were talking about that. I said, honestly, there's some families who I probably wouldn't even mention it to them because logistically, I don't see this. I don't know if they'd ever be able to use it. And it's like, is this even, it feels like you're just jangling something in front of their face that they're never able to access. But then I was telling him, I said, then I was checking myself and I said, well, really, I should be mentioning it to everyone and then let them be the one to figure out if they can make it work or not, but
that's you making an assessment based on your knowledge and then saying like, geez, well, maybe everybody wouldn't have that. But I also don't have a ton of time to go over every goddamn last thing. Like I got to make decisions about what we're going to talk about.
Yeah, exactly. Yeah. Right. And I don't know, and sometimes it's again, just like finding resources. Sometimes I do feel like having community, I think helps even for the families. Like if you, I don't know, just having that community, my nurse practitioner, we were talking, she had a patient of hers who it was a type 1. And then I don't know if it's like the moms knew each other and somehow the kids met or something, but the other girl that's also our patient was a type 2, but insulin dependent type 2 and always in very poor control. And then the moms ended up like linking up the girls. And then all of a sudden, like the type 1 who was very controlled, like rubbed off on this little girl at type 2. And like, I mean, literally the girl with type 2 used to always have like A1Cs greater than 14 and has been running in her A1Cs in the 8s for like over a year now.
That's why I love the Facebook group, actually.
Yeah, it's just like having that like positive peer pressure.
it allows you to sit in the background and watch it happen without having to be involved in the conversation. And it just sort of like rubs on you a little bit. You're like, oh man, all these people are doing this. I could probably do this.
I do mention the Facebook, like, I mean, I'll mention the podcast, but I know a lot of people may not even, they just don't do podcasts, but like, I do notice like I have quite a few people in the Facebook group. And again, even if they're just like a fly in the wall watching it and like watching posts, I still think they can learn from it. And
do you have that personal pain? I know what the podcast does for people. Like I've tons of feedback. It's not just one person or a couple of people it happened to. You'll hear like varying levels of like, I started episode 1 and it took me a year and I listened to the whole thing. And hey, my A1C is 5.5. Look at this. Like, right. Like I see that. I see people are like, I listened to the pro tip series and I got my A1C down to a 6.5. And I'm like, oh, that's great. Or newly diagnosed into bold beginnings, which is basically kind of pro tip light for newer diagnosed people. And it got me on the right path. And 2 years later, here we are. Like, I know it works. And when I can't get it into people's hands, it feels like a personal failure. And when you see like the Facebook group is such a great example. It brings in 150 new people like every 3 days. And I don't see those people one-to-one translate into listeners. And I think, oh my God, I got you. I feel like I brought them like right to the finish line and I couldn't talk them into taking the last 3 steps. And do you feel like that in your job? Like, oh my God, I know what to do. I could help you if you listened or if blah, blah, blah. Does it feel personally, like, forget all the business aside and like what you feel like as a doctor, like when you're at home and it's quiet, do you think like, I feel like I let people down? Do you ever feel like that?
I don't necessarily feel like I let them down because I feel like I'm trying. I mean, I get frustrated and I get sad. Like I get, just that this is the state of it for many patients. Like I can educate till I'm blue in the face and it doesn't seem to be clicking whether it's a lack of understanding or a lack of ability or drive or whatever that is. And more so, I mean, I think I'm more like in my head, it's like, okay, what else could I do? Like what else could we do as an office or, as a health system, like to better support these families? It's probably more aware, like not as like that I let them down, but just more so like more of a like, okay, what are we missing? What can we do to try to like reach these people, to try to help this person not, come in and decay again, or, to get that success of like coming into our visit and their A1C like coming down.
I have an idea, but I'm going to share it with you when we're not recording because people will rip me off and I can't have that. Seriously, the other day I watched, like you said earlier about like a diabetes influencer, and I wanted to joke and say like, I didn't know there were other people doing this. I thought it was just me. But I do see people like, I'll put out an episode about something on Monday, and by Friday they're talking about that topic in their, on their channels.
Stuff.
And I'm like, you sons of bitches. I was like, just have your own goddamn idea and leave me alone, please. But listen, the other side of that is I feel like I'm having a positive influence on the noise that happens in the space that helps people move towards good stuff. And so I am very happy about that. Like, but business side, I'm like, have your own, because these are, trust me, all those influencers, they're all making money.
Oh yeah.
Or they're trying. And goddamn, trust me, because I've seen it. I see it happen every year. If they can't make money off it, they're going to stop helping you with your diabetes. I'm the only one who was like, I'll do this for free. I think I can turn it into something. And I've turned it into something that's popular enough that I don't have to worry about my electric bill getting paid anymore. It happens now, right? So I can throw myself into the podcast. Most of those people are not in that situation. They are trying to make $100 from a pump company to say a pump's name out loud. And it's a hustle. Trust me. But I have an idea and I think it'll work. I'm worried that I'm not the right one to face it. And then I don't know how to handle that.
Yeah, we can definitely.
Yeah.
You can definitely tell me your
we'll see. You can steal my idea. No, I'm just kidding.
No, I don't need to steal it.
No, because I do want to get your input, just not when we're being recorded.
Yeah. I think, like I mentioned, just the community aspect. I think there is some benefit to that, especially when I think as parents, like raising.
Is that where camp could come in for people who are struggling like that?
Yes. Yeah. So we actually, last year I started, so in Georgia, we have Camp Kudzu, which is based out of Atlanta, a children's type 1 camp for children with type 1 diabetes. This is the 25th year.
Oh, wow.
So I've been involved with that camp since I was in my year off between undergrad and medical school, when I worked at an adult endocrinology office, which is where I discovered my love for endocrinology, and started volunteering at camp and had been kind of on and off throughout my training and whatnot. And so this past year, we started a new session closer to in the middle and South Georgia area to serve the patients that I serve. And so we started that session last summer. We do the overnight summer camp, but we also do little one-day events. Camp Kudzu does them all over Georgia in different cities. And it's just a chance for the families to come together. And they also do family camp on weekends, I think 2 or 3 times a year. So I'm hoping that I'll get a family camp session going at the location that I use for my camp session. Again, just to pull people together. When we did one of our one-day events, Dr. Ponder actually came and talked on it, and he gave a sugar surfing lecture to the parents while the kids were playing. And then we all kind of came together and did games and stuff with the whole family and the kids. And I mean, just the parents, hearing his lecture and then getting some time just to talk to each other. From that, it spawned a whole, they made their own little Facebook group, and they, just being able to meet other families that are going through what they were going through was such a, eye opener. And the kids, all loved it too. The kids, one of my patients, he's type 1 and Down syndrome. He came to our overnight camp last year, and we did an interview about camp a few weeks ago. And literally right when he first saw me, he was like, Dr. Hutchins, what's going to be the carb count for lunch on the first day of camp? And I was like, I have no idea. But it was just so funny. He was literally could not stop talking and thinking about camp. He was so excited about camp.
Cool. And I've never been invited. I just want to say.
Trust me, like that is like something that's in the work, especially when I saw Arden was in Georgia. I was like, okay, Scott's going to be in Georgia. So I got to figure out when he's here and how I can get him to something. Trust me. That is in the back of my head.
I would definitely come. So, but there's no pressure, obviously, if you don't want me, and it's fine. It's
well, and a lot of my patients listen to the podcast. So like, they would definitely come. I mean, even Dr. Ponder coming was a big deal, but a lot of people didn't know Ponder, like if they were like newer diabetics, just because I felt like some of the older diabetics, were familiar with his stuff, but newer diabetics are familiar with you.
This has got nothing to do with Dr. Ponder, but it's so hard to stay in the zeitgeist once you get into it. And like I tell people, like, I'll say it on here too, like, but I talk privately about it all the time, like, doing business and stuff like that. And people are like, what are you most proud of? And I was like, longevity. I was like, keeping this train moving is hard. And keeping it popular is hard. Like you can say something really valuable, but how do you say it again tomorrow without people going, I heard you say that already.
Yeah.
And how do you stay in it long enough to get to the next group of people? And then how do you not get bored because you're like, oh, I just said this to a bunch of people 3 months ago. Like there's that, like, that's hard. I'm good at it. Like, so like that's meaning I don't get bored by helping people in the early parts of their diabetes.
Yeah.
Yeah. So it's just, and it's so, and the social media part of it, like I'm not begrudging anybody who's trying to knock out a couple $100 at a time going like, I wear an Omnipod, like good for you. Like, I think that's terrific. Right. But that's not a thing you can keep going for long.
Yeah. No, you have to.
It's not a real job. It doesn't grow into the thing you think it's going to grow into. And then how do you keep, and it's content. People want content constantly. I laugh when I used to sit around and I wrang my hands for 2 years. Could I put 2 episodes out a week or would that make people upset? I don't know what I should do. 2. I think they're going to stop listening if I put 2 out. And then I put 2 out and people are like, oh my God, this is great. Can you do more? And I was like, sure, here's 3. And they were like, well, why, what am I supposed to listen to on Thursday? And I was like, valid point. And then, and before I knew it, it was like 5 days a week. And then last weekend, I was like, I've got all this extra stuff. Like, I'm just going to put it up on the weekend. And I thought, well, this is definitely going to piss people off, except this was a really popular week of the podcast after there being 2 episodes on Saturday and Sunday.
That's too funny.
Like I was just downstairs right before you and I talked, right? My son is applying for a job. My wife is at home working. And I'm like, hey, I got to go work. And my son laughs because he's like, you're going to go upstairs and talk to somebody. And I was like, well,
yeah, that's work. That's my job.
I'm like, that's my job. And so I'm going to go do that. And I said, then I'm going to take a quick break and then I'm going to do it again. I'm in a half an hour, Jessica, I'm recording with Erica on a resilience series that we're putting together.
Oh, she's the therapist. Yeah. I've listened to some of hers.
And then I'm going to get done and I'm going to take a deep breath and eat something. And then I'm going to come up here and put episodes together for you guys for next week.
Yeah.
If that's not actually your job, there's no way to keep it going. Like there just isn't. Yeah. So the influencers who you're thinking of right now, like in your mind, you're like, oh, I love this person on Instagram or something like that. Write their name down and then go into your phone and say, hey, Siri, 12 months from now, remind me to go look for this Instagram account.
The other group, one of the things I mentioned on the list of things I would talk about, diet. So the other group that I follow and I guess that I'm quote unquote popular in is the low carb group. Yeah. And so I am low carb friendly. In
your practice?
In my practice, like a lot of peds endos are not low carb friendly. I have, a few patients who come to me because like I'm familiar with like Dr. Bernstein's method and the like type 1 grit and like let me be 83. And so I have some who like just come to me for that. And like with a new onset, I'm not like, hey, you must do low carb. If people ask me, I did have a patient that when I first started, it was actually a person I met at church. And then she found out I was a pediatric endocrinologist. And then she was like, hey, my son has like a pre-diabetic A1C and his pediatrician's been watching it. And I was like, okay, check the antibodies. He had like all 4 of the antibodies were positive. I'm like, okay, he is going to get type 1. And like at this point, his A1C was like 6.2%. And I was like, and I didn't start work for like another month. So I was like, okay, so now until then, just like try to go lower carb, just that you can maybe delay this until I start working. And so they went lower carb. He was actually able to go 2 years. Like he basically honeymooned with a completely normal A1C in the low 5s for 2 years before needing insulin.
Yeah.
It was amazing.
Yeah.
And he's still low carb because at this point, they're used to it. And he now is at the point where he needs injections pretty much every time he eats. But they're like some of my low carb patients, they use the regular insulin for like the protein to match the like rise of the protein. So they use like long acting and they have to use R. Not every meal, mostly dinner, because that's when he eats like a lot more protein is at dinner. So I am like familiar with that as far as like dosing with R. And so, yeah, in that way, like you mentioned earlier about me being progressive. So I feel like in that way is like with the looping and like being like low carb aware and friendly, it makes me a little bit more progressive, I guess.
Because that's who you are. Judge me on that. How am I with how people eat?
I think you're like me. Like you're like, you do you. Like, because you like did that whole diet series where you like, and you had low carb people on there. Mm-hmm. Not you. I think in the Facebook group, like some people like can get back and forth about it, you know, whatever. But I mean, I think you're like me. I think you're like, you do you. Like if that's what you want to do, then you can do that. At the end of the day, you just want to make sure like they know how to manage insulin. So,
yeah, that's exactly how I feel. But every once in a while, I'll get like somebody comes after me, like a very like zealous person will come after me and be like, you're stopping us from talking about this. I'm like, I'm not talking to you about anything. I'm like, you just can't come in here and like ring a bell and proselytize and tell people that if they eat a carb, they're going to die. Like, and then there's like, that's not what I said. I'm like, you should reread what you just wrote because I don't have a horse in the race. I don't even care.
Yeah.
It's meaningless to me how you manage your food. You should eat whatever you want. I really genuinely mean that. But when I'm managing the group, it's a different scenario. Like I have to protect everybody, not just some people. Like there's a post that went up the other day. I'm actually going to get to record with the person soon. And I'm excited about that because it's a really nice, kind person who's trying to share what they figured out. And they put up this post and I can't wait to ask them face to face, like, what did you think the tone of this was? Right? Because I bet you they were excited and sharing good news. And if you read it, it feels a little like if you just did what I did, you'd be healthier.
Yeah.
And like, right. And so I'm also not saying that's not true. Like, I'm just saying like, I guess my point is that if just telling somebody what the right thing to do was, then the last hour of our conversation wouldn't have sounded like it did. And the answer to those people's problems isn't eat low carb.
Yeah. For some people, that isn't an option. Again, it goes back to like the privilege. Like it can be a little bit more expensive to eat low carb.
Also, if just saying the right thing out loud made the world correct, then we wouldn't have any of the problems we have. You just go, oh, no, exactly. You know what? You can't do that. And people would go, oh, I didn't realize. And that would be the end of it. Yeah. That's not how it works, right? And when these people come in with their super excitement, and I'll say, hey, look, you know, just please keep in mind the tone of what you're saying here. It feels a little judgmental, blah, blah, blah. And then somebody will go, well, you tell people they can eat a cupcake. And they come in here and ask how to dose for something on a restaurant that's obviously got 150 carbs in it. And that's not healthy for them. And blah, 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 blah. And I'm like, what does that have to do with anything? I'm not telling them to eat that any more than I'm telling them not to eat. I'm not telling them not to be low carb. And I'm not telling them to go get a waffle with a pancake on top of it and a sundae. Like, I didn't say that either. You know what I mean? Like, all I'm saying is whether it's the waffle with the pancake with the sundae with the cupcake, or it's a steak, you got to know that there might be a protein rise from that steak.
Exactly.
And you got to know that the waffle with the pancake with the thing is going to need like a half an hour pre-bolus and like a cartload of insulin. And you might get really low later and you should pay attention to all that. Like,
exactly.
Not my job to teach people how to eat. And by the way, it's no one's job. And if it was your job, it would be an absolute loser of a job that you would never, you're going to preach to the choir and think that you're converting people, but you're not. You're just converting people who were up to be converted anyway. And I feel comfortable saying that because there are times that I think my podcast maybe isn't as valuable as I think it is. It's just valuable for the people who it's right for. Mm-hmm. And I would like it to be valuable for more people. That's what I'm trying to figure out. And I goddamn well guarantee that telling them what to do is not the way to get them to it. So I just mixed two issues together, but they're the same. Oh, I didn't mean to curse. Saying. Yeah, they're the same thing. You're a doctor. I feel weird. And you go to church and I just cursed. Bleep that out, Rob, please.
Gosh, my
You're also from the South. I assume you curse all the time.
I laugh because like my husband, like, because I did not grow up going to church. My husband did. And so like,
oh, he's dragging you.
When I curse, he like gives me the side eye and I'm like, you're fine. Like,
isn't that interesting? The lady who was brought up nicely didn't go to church. The guy who was getting backhanded did go to church. Oh, well, I don't want to get into that right now, but
don't you know that's what the Bible says? Spoil the rod, whatever.
I don't know. Listen, I don't want to hit people, but every once in a while it'd be nice if I could have a 5-minute pass. Yeah, I'm sure we all feel like that. Anyway,
So I drop a few curse words every now and again. So your cursing does not offend me.
I love to curse. It's one of my favorite things to do. All right, well, listen, you have your own problems. You got to go figure out how to parent small children, which it sounds like, if I'm being honest, you're struggling with. And like,
there you go.
And by the way, I want to thank you for coming on here. People know who you are. You're a physician. You're an endo. And you said a lot of things that sounded like, I don't know. And I thought that was really honest. And I appreciate that very much because I think it'll help people to hear you say, look, I can't get my kid to put on a CGM. And like, he ran away from me. Like, what do you want me to do? Like, and you were just like, whatever. So you didn't chase him down, right?
I chased a little bit, but then it was like,
was there cursing then?
No, if I knew he actually had diabetes, his butt would be wearing a sensor. Like, there would not be an option.
Did you consider money? I would have dropped money on the problem, like nothing. He'd have been running away. I've been like, can you smell this 20 I'm waving in the air? Smells like Legos. Come here, kid.
I don't know, but he responded to money. He would probably respond to like Roblox, like money on his Roblox iPad game or something.
Yeah. Just got to explain it to him correctly. That's all. You just got to understand where the push and pull comes from.
Yeah.
You're great. I'm sorry it took us so many years to do this.
No, you're fine.
And at the very end here, let me thank you personally for the help you gave me when Arden wasn't feeling well last year. I appreciate it.
Yeah. So now I know we've been on for a long time, but I do want to hear more about the GLPs. You were talking about that. Arden doing the GLP one.
You want 5 minutes? I'll give you 5 minutes.
Yeah, you can. Yeah, give me. All right. You can give me the.
So I had Dr. Blevins on yesterday. And he'll be on again in a few weeks and on again a third time answering questions. He is an endocrinologist from Austin, Texas, who I found through YouTube. I was watching YouTube videos back when I was trying to understand what it was I was taking. I had that moment a few weeks into my use of a GLP medication for weight loss where I was like, I should probably know what this is. So
just a little bit.
Why don't I try to understand exactly what I'm injecting into myself, right? And so I looked into it. I found him just doing a talking head video that I just found to be very clear and thoughtful and well sourced, I thought. And so I invited him on. Anyway, he's been on. There's an episode about a 15-year-old girl whose daily use, if you haven't heard this one, Jessica, her daily use, she's a 3-year type 1. She ended up on Wegovy because of what they thought was PCOS weight gain. And her daily insulin has gone from 70 down to 6. Like
that's
daily.
Insane.
Yeah, she took her pump off and she's only shooting basal right now after having type 1 for 3 years and using 70 units a day. And so that's happening. I am almost to my absolute lowest weight right now since I started back in April of 2023. Is that when I started?
That's awesome.
Yeah. Arden is using it. We are like scraping it together any way we can. Our doctor's about to take a different stab at getting it covered by insurance again. So we're getting ready for that. But she's doing 5 milligrams Mounjaro right now. Actually, I would say weekly, but last week she's like, Dad, I shot it like 9 days after I shot it the next time. She's like, I was in class and I forgot.
Yeah, she just forgot.
But you can literally see the difference.
I remember you were saying on that episode. Now, because I know she wasn't really like overweight. Did she lose weight too or not really?
No, she lost weight. Yeah.
She did? Okay.
Yeah, she looks... Now, there are going to be some people, and Dr. Blevins and I are going to talk about this in one of the episodes, where people just have this knee-jerk reaction where they're like, you're too thin, like that feeling. Mm-hmm. She's not too thin. She looks incredibly healthy.
Yeah.
I'm not too thin. I think it's possible we're all just used to seeing heavy people at this point.
Agreed.
Yeah.
I mean, often like we get referrals for like obesity, and a lot of times I feel like the family will be like, they look normal to me, and I'm like, I mean, honestly, like compared to a lot of their peers, they probably do look about average. And it's like the kids who are like normal weight, the parents are like, they're so skinny. I'm like, nope, they're 50 percentile. They're perfect.
There are times that people put pictures of their overweight kids online eating really crappy food. And I think, oh, wow, this is an indication of what they feel is normal.
Mm-hmm.
Like it really is interesting, right? Because even just from like I'll tell you from my personal perspective, if when I was 45 pounds heavier, you weren't going to catch a picture of me having a pancake somewhere. Like, you know what I mean?
Because you're self-conscious about it.
Oh, because I'd be like, I probably look like that because I ate this pancake. And so like, but it's interesting. I'm not judging people. I'm saying it's a very interesting look into popular culture and all that. And my point being is that people will come up to me and go, oh my God, you got to stop losing weight. And I'm like, I need to lose 20 more pounds.
Yeah, you're like, I'm not at my ideal body weight.
Yeah, and forget ideal. Like, do you not see the fat right here? Like, this is right in the heart attack spot. Like, you know what I mean? And they're like, oh no, you look great. I'm like, I look better than I used to. And listen, I do look great, but I'm not healthy yet. And that's, I don't care how I look. I care about not dying. Like, right?
Exactly. No, I feel that.
So Arden,
now with Arden, out of curiosity, so I know, does she have 2 endos? Do y'all see a regular endo and then also the one that's like the lady that did the thyroid episode?
She just sees her now.
Oh, okay.
She's her adult
I was curious.
endo.
I was like, I was wondering, did her other endo prescribe the GLP-1, or this is the one that's more like functional medicine, naturopathic kind of like sees?
It's her.
Okay.
And
that makes sense.
Yeah, because when Arden turned the age, Chop was like, get out of here.
Gotcha.
They were like, she's in college right now, so we'll help her for another couple of months till you can get back, but then you got to get out. And I'm like, okay, I would think you'd want the guy from the podcast around, but that's fine. And
whatever.
Laws and insurance and everything.
Exactly.
One of the luckiest things that's ever happened to Arden is that Addie took her on as a type 1 patient.
Okay.
Because Addie doesn't even take new patients.
Type 1s. Okay.
And she doesn't manage type 1s for the most part.
But you manage her type 1. I mean, like,
Addie was like,
she's just refilling your insulin and your pods and Dexcom for you.
Yeah. She's like, what am I supposed to be looking at here? And I'm like, oh, don't forget to ask about her eyes every once in a while. And like, but no, like, she's a terrific doctor and looks into things. She's the one who was telling me 2 years ago, like, hey, maybe let's try putting Arden on metformin and see what happens to her insulin sensitivity.
Did it help? I use metformin in my type 1s.
We never did
sometimes.
We went right to the GLP. The GLPs happened so quickly that by the time we got our head wrapped around what we were going to do, she's like, let's just give her a GLP. Now, you're right. It's not covered by insurance. But we got a sample pen and a couple of them. And then we hit her with the pen. And I was like, I will do anything for her to have this.
It just helped her so much.
Yeah. Now, in fairness, it is not costing me $1,200 a month. Like, we're buying a pen. We're using it more sparingly than that, like that kind of stuff. And we've relied on a couple of samples here and there. We're literally in a flux period where I have to find a way to get insurance to cover it. Yeah. Like, I can't keep doing this.
I had one patient with type 1, and now he aged out and he's in the adult world, but he was type 1, but weighed like 300 plus pounds and not the most compliant teenage boy. And with lots of fighting with his insurance, and I think they had like Anthem or something, or one of those at the time. It was private insurance. We were able to get it covered. And this was actually like 3 years ago. So that was Victoza, because that's what was like kind of out then.
What they're doing now is you're getting a double diagnosis. They're basically diagnosing you have type 1 and you have insulin resistance.
Yeah. Well, and you're morbidly obese. Like, I mean, you need it for your obesity.
Well, that,
and
I mean, nowadays.
It helped him. When he was on it, he lost like 20 pounds. He had never lost 20 pounds. And I mean, his A1C got a little better. I mean, again, he still wasn't very compliant with his insulin regimen. So,
but that person now would be right for Wegovy or Zepbound, and it would probably be covered by their insurance. For Arden, like, it's going to be insulin resistance. Like so
she doesn't meet the BMI criteria, I'm assuming.
She didn't meet the BMI criteria when we started. Yeah. But what she does meet is her insulin needs significantly dropped. Her spikes are lesser. Her acne's cleared up. Her periods are easier. They don't have studies yet on what it impacts. But if you go to any reasonable OB at this point, they're going to be like, hey, if you have PCOS, try to get GLP if you can. That's literally how they talk about it to you. They're like, if you can talk a doctor into giving it to you, you should. I've had a GYN tell Arden, like, I can't prescribe it. They'll turn it down. Like, she's like, but if you went to your endo and like, are there other reasons? And so we started off with like, look, this is just good. Try it. And now we're about to, my wife just switched jobs. So we're about to put it back into the new job and try again. Yeah. And I think Addie is going to just say, look, you call it whatever you want, but this girl's got insulin resistance and she's got type 1. So if you want to say she's type 2 because of coding, I don't care. Sure. But this is what's going on. Now, I don't know how long insurance companies are going to do that, because right now they seem to be doing it, but they could change their own. But
I have a lot of Medicaid patients. So Medicaid, like, I mean, I can get my type 2s on it, but like obesity and anything outside of a diagnosis of type 2, like they're not good. They won't cover it.
Yeah.
And even then, a lot of them, it's like they'll cover Trulicity, which the Trulicity isn't really
nice
working
all,
as well.
But it ain't gonna help like this stuff. This stuff's like, I don't want to call it magic, but holy crap.
It is magic.
Yeah.
It is magic.
I upped my dose 2.5 weeks ago. I've lost 6 pounds.
I need to get on it. I had gotten a sample of like the Wegovy a long time ago, but it was like when the back order was so bad. And so like I got the sample, the 0.25. I mean, I didn't really feel anything on the 0.25, but then when it was time for me to like get a refill on the next dose, like it was nowhere to be found. And then I just didn't go back and pursue it.
If you think you need it, do it. It's
I know I
so
do,
worth it. Yeah.
I have a 2.5-year-old and have yet to like lose that extra 30 pounds post baby.
Let me tell you something right now. I was out today and this young girl comes to help me. And I looked at her and I thought, how is she, like, it's the middle of the day. How's she not in school? And then I thought, oh, high school's over. And so I said to her, I'm like, oh, I was just about to say to you, like, shouldn't you be in school? Like, you know, and she goes, I should, but I'm in college. And so you could even see her going like, I know people think I look really young and everything, but I'm not in high school. I'm in college. And I said, oh, don't worry. Looking young will really help you when you get older. And we were chatting for a second and she goes, how old are you? And I said, guess. She goes, and she's like, I don't want to insult you. And I was like, just say what you think, you know? And she goes, late 30s. And I went, I'm 52.
You're like, yes.
And I was like, this is great. And like, but she was really stunned. I'm like, even if you were being polite by 10 years, you were still off by 7 years.
Yeah, that's nice.
And I said, this is my point to you. I was like, yes, it sucks now because everybody thinks you look like you're 12. But when you're 52 and someone goes, oh, what are you, 35, 40 years old? You're going to love this.
Yes.
But the truth is, Jessica, that a year ago, she would not have said that to me.
Because you looked old, because you were unhealthy.
Exactly right. I am at a level of health now. Like, I don't care about how I look. It's fun to like joke about and everything, except every once in a while when somebody leaves me a review and is like, you're so privileged that you have this. Like, but I know I am. Calm down. I feel better. I am better health-wise. I mean, if I still looked like I looked a year ago and I felt like I felt today and my labs came back like they came back recently, I would still tell you I'm taking this stuff. You know what I mean? So anyway, I have to go, but I was going to, I wanted to ask you about low dose naltrexone and autoimmune. Have you gotten involved in that at all?
I have not.
Okay. Well, I'm going to save that for another episode. I'm going to try to find somebody who's been using it or something like that. Apparently, you know what it is, right?
I have heard of it, but I've never used it.
People are using it for like autoimmune issues now and for like pain and swelling and stuff like that, inflammation. Anyway.
I'll have to look into it. I'll have to Google it.
Yeah. Let ChatGPT tell you about it. And then it'll tell you how to build a bomb that it will use on us one day. Thank you for doing this very much. I appreciate it.
Yes, no problem. All right. Have a good day.
Yep. Hold on a second. A huge thanks to Touched by Type 1. Don't forget to go to touchedbytype1.org and get your tickets for the big upcoming event in September. Jalen is an incredible example of what so many experience living with diabetes. You show up for yourself and others every day, never letting diabetes define you. And that is what the Medtronic Champion community is all about. Each of us is strong, and together we're even stronger. To hear more stories from the Medtronic Champion community or to share your own story, visit medtronicdiabetes.com/juicebox and look out online for the hashtag Medtronic Champion. A huge thanks to Dexcom for supporting the podcast and for sponsoring this episode. Dexcom.com/juicebox. Go get yourself a Dexcom G7 right now using my link. The Diabetes Variables series from the Juicebox Podcast goes over all the little things that affect your diabetes that you might not think about. From travel and exercise to hydration and even trampolines. Juiceboxpodcast.com. Go up in the menu and click on Diabetes Variables. If you're not already subscribed or following in your favorite audio app, please take the time now to do that. It really helps the show. And get those automatic downloads set up so you never miss an episode. Thank you so much for listening. I'll be back very soon with another episode of the Juicebox Podcast. The episode you just heard was professionally edited by Wrong Way Recording. WrongWayRecording.com.